Good morning, everybody. I'm Charlene Lovett. I am the mayor of Claremont, and I have been invited today to speak with you about our approach to preventing childhood lead poisoning. I'd like to thank Mayor Donches and his staff for providing this venue from which we can discuss this very important topic. So my presentation is going to consist of about 10 minutes of an overview by me, and then we will be joined by our panelists. On the panel, we have our former Director of Department of Public Works, Vic St. Pierre, and then we have Derrick, who has worked extensively with Habitat for Humanity and then joined our team early on to focus our efforts on lead-based paint and getting funding to address that issue. And we also have Steve Coombs with us. He is our chief inspector with the city of Claremont in the Planning and Development Department. Once we hear from the panelists, I then will turn it over for a Q&A. If you have any questions, please put them in the Q&A box. Thank you. So our story started in August of 2016. It began with a conversation in the city manager's office about lead in our drinking water. Not that we had any tests that came back higher than the EPA standard, but if you remember 2016, the issue of lead was focused on what happened in Flint, Michigan. So we were talking with some scientists who came down from the Department of Environmental Services. And during that conversation about lead and water and the potential of that, one of the scientists had said, well, that's not our primary source of lead poisoning in New Hampshire. And I said, well, what is? And she said lead-based paint. So that started my journey of researching the issue and finding out, well, what does this mean for Claremont, for the state of New Hampshire? So in the research, I had found out that the state as a whole has 62% of its housing stock is pre-1978, but Claremont is much higher than that. We have about 84% of our housing stock is pre-1978. Our water distribution system dates back to the 1800s. Of course, we had lead in the service lines and the connectors. And then I found out that between 2010 and 2015, 194 Claremont children, just Claremont children, in those years have been poisoned by lead. Now, the threshold for that, according to CDC, is 5 micrograms per deciliter. That at the time was not the threshold that the state followed. The threshold that the state followed was 10 micrograms per deciliter. But when I found all of this out, I thought, how come we are not talking about this? I mean, here we have children who are poisoned by lead, and I had been in public service for many years at that point, and I hadn't even heard the discussion. So I reached out to the Division of Public Health, the Division of Health Services, Public Health Services at DHHS, and I asked them, and they kind of pointed me to all of the data. And when I realized the human and economic impact to our communities, it was a very compelling story. So the next thing I did was I went back to the city manager and I pulled in some key stakeholders in the community. So the CEO of the hospital and the superintendent and school board chair of this Claremont School District. And I shared the information that I had found. And we got consensus that this was worth pursuing. So we went further and said, well, who else in the community do we need to gather? And we looked at all aspects. And I can't stress this enough, the importance of a team-based approach, because this is a huge issue. It's been around for a long time, and we've had periods in our history in which we have tried to deal with lead. If you remember in the 1970s, I believe there was a campaign to talk about lead-based paint. I believe there were commercials that you might be familiar with where you had the idea of kids had to eat paint chips to be poisoned by lead. But the problem is far worse than that. And you'll find that people have the impression that, oh, this was done in the 70s and resolved. So when you're gathering your key stakeholders in your community, and here's just a list of the people that we reached out to, keep in mind that this is a problem that's been going on for quite some time, and there may be people in your community that have had previous commitment to resolving this issue, like Healthy Homes Committee. Now, they may or may not be active in your community anymore. They had been in the past. So reach out to the people who've worked on this issue before. And then once we identified all of the stakeholders, then we held a joint meeting of the City Council and School Board. And at that joint meeting, we had the core key stakeholders at the table. And then we invited somebody to come in from the Childhood Lead Poisoning Prevention Program, Gail Gettins. You probably will hear from her today. But I highly encourage bringing your subject matter experts in, because we're all learning about this problem at the same time. And that's the other key. If you can level set everybody from the very beginning, give them all the same information, and get everybody to understand how serious this issue is, you will save yourself a lot of time and energy, because you will need a broad-based support to really effectively deal with this issue. So after we had the joint City Council School Board meeting, and we had other key stakeholders at the table, and keep in mind that all of our meetings are recorded and on our closed caption TV network, so people can refer back to them. Once we had done that, we went around the table and said, given the information that we all have at this point in time, are we committed to making this a community-wide priority? And we did just that. And it was reflected for us. I don't know if your master plan includes a section on public health. Ours does. We happened to be working on our master plan about the same time we were dealing with this issue. So we incorporated into that chapter of our master plan a goal of having healthy homes, which meant addressing the issue of lead. So our community-wide priority is backed up by some foundational documents, that being the master plan. And then once we did all of that, then we had lots of public forums. Sometimes they were geared for specific groups like special education teachers. Sometimes they were geared for childcare providers. Anything that, if you want to reach a certain group of people, I highly suggest having a public forum that's geared for that group, and provide dinner, provide snacks, continuing education units if that's applicable, but use those opportunities to answer people's questions and dispel misinformation. Like I said before, there is a lot of misconceptions and misunderstandings about lead poisoning. One, that people do think sometimes that it's been resolved. Another common concept is that, well, it didn't hurt me, I'm fine, so it's not really that serious. But I highly recommend that you look at the data in your community and understand how serious this is. So, as you can see, we've been working on this for a little over 4 years, and we've accomplished quite a lot over that time. We've had action groups, which are very important, because you're going to find that no one entity has the bandwidth or all of the resources to address this problem, and volunteers come and go. but the priority, the community-wide priority doesn't, whatever the community has decided to do. So you're going to need to have a focused group on going after the things that need to be done to really prevent childhood lead poisoning. So we did a lot in a relatively short period of time. We did a school board policy that stated that kids coming into the Claremont school system needed to have 2 test results of being tested for lead. Parents could opt out. It's not a requirement, it's not mandated, but that raised the awareness. And then we looked at how do you remove all of the barriers that prevent people from really addressing this issue? So screening is step 1, right? Ultimately, the goal is prevention, but screening ensures that at least you're identifying the problem as soon as possible. So, you know, we would have screening tables set up at back-to-school festivals, community events, so parents didn't necessarily have to make an appointment, a doctor's appointment, to get their child tested before school. It was done right there at the back-to-school festival. So anything you can do to kind of make it easier for people to get screened, and then anything you can do to go after the funding that's going to be required to really prevent the childhood lead poisoning. No one community is going to have all of the resources, and I know you don't want to raise taxes to try to resolve these issues. So there is money out there, and don't take no for an answer. If people say to you, well, you know, that's too difficult to go after, you'll hear more later on that we went after the things that we thought were very difficult, but we were successful. So other things that we wanted to do, we wanted to create a workforce that had a broader workforce that had the certification, had the knowledge of how to deal safely with lead-based paint. We did that through training at the county jail. So people who were coming out of the county jail, they had new skill sets. We also did that type of training at the tech center. So high school students who were graduating could at least say that they were RRP certified. In the city, we had, during the permitting process, we requested people's RRP certification number. Again, it's incorporating into your operations the awareness of lead, asking for the certification, distributing information if people don't have it, but making it part of your daily operations. And then finally, we had the goal of 100% removal of lead in our water distribution system. And we went after state funding to get that accomplished. So in the course of 4 years, have we been successful using a community-based approach? Yes, our work isn't done, but we've achieved quite a lot. If you recall from the first slide, when we first started this in August of 2016, the statewide statistics using 2015 data was a screening rate of 53% for 1-year-olds and 27% for 2-year-olds. Our screening data for Claremont using 2018 data has increased on both sides, most notably in the 2-year-olds. So getting the word out does work. As I said earlier, we have a better trained workforce because we have more people RRP certified. In fact, I took the RRP training. It's not that difficult, but again, it's raising the awareness of what you need to do when you're renovating or if you're in the contracting business to keep you and your family safe. And we have high school students who now have an added skill set that makes them more valuable in the workforce. We've received lots of funding from various entities, as you can see. And most importantly, I think what I am most pleased about is there is a community-wide awareness. It's part of our conversation. Like I said, it's in our master plan. When applications go before the planning board members are thinking about lead when they're asking their questions. We've got contractors and homeowners reaching out, proactively reaching out, not after an abatement order has been issued, but proactively, because people are aware of the damage that it can do, and they don't want to do that to their family and friends. So in conclusion, I'd just like to emphasize that childhood lead poisoning is a serious issue, and we are inundated today with lots of different problems. The good thing about childhood lead poisoning, it's preventable, and we already have the solution. We just need the will to address the situation. And this is a statewide problem, and it requires broad engagement in every community, and communities are responsible for bringing people together to really address this issue. At the end of the day, you know, you can research and have all of the data at your fingertips. You can understand the magnitude of childhood lead poisoning, but we can't forget that behind every number of a child that's been poisoned is an actual human life. The impact of that child, if he or she has been poisoned by lead, depending upon the severity, can really prevent that child from reaching his or her full potential. Not only is that a travesty to the child itself, it's a travesty to the family because of what they have to deal with as the effects of childhood lead poisoning manifests itself. And finally, it's a impact to a community. Every community's most valuable resource are its people. And vibrant communities have people that are fully engaged. And when you have childhood lead poisoning incidences, that prevents that child, when they reach adulthood, to be fully engaged in the community. So there's a human cost, there's an economic cost, whether it be in special education. There's a correlation between childhood lead poisoning and special ed. There's an economic cost on the judicial side, because as children get older who have been poisoned by lead, they can be very aggressive in nature. So there is no reason for us not to move forward on this aggressively. So I encourage every community out there to really look at the situation, understand it from their community's perspective, and go after the resources that are out there to address it. Now I'd like to turn it over to Derrick, who has really been leading our action group's efforts to secure some housing funding for really addressing the issue of lead-based paint. Don?
Thank you, Charlene. Hello, everyone. I think this system shuts us off on time, so I'll kind of rip right through this thing and get done. So Sullivan County has been selected to receive a $1.7 million HUD grant to deal with removing lead paint from houses. And so we're thrilled about this. We just found out about it. Many people to thank for this. Most of them are here today. Katie Bush, Bev, Gail, Natalie Vetter, Ross Malcolm, Tom Irwin with the Community of Action for Lead Safety. That was a big deal. So two things to talk about. One is primary prevention, taking lead out of houses, and also the newer idea of trying to bring market forces to bear on this problem. So we'll be putting out white papers about what we've done and what we're going to do, and that'll probably be the best way to help people. If other people want to do this, other smaller cities and towns, which they can, we can save them a lot of time because we've spent a lot of time. So the HUD grant, our first principle and our strongest principle is to be proactive. We want to get these houses fixed before a kid gets poisoned rather than react to a kid getting poisoned. The second principle is that the work should be as close to zero cost to the property owner as possible. And this is not some socialist dream. This is, in our opinion, the way projects are going to get done. So I'll come back to that part later. So starting off, we put together a group to see if we could mobilize volunteers, nonprofits, philanthropy, and some grants to formulate a safe, legal, effective, and practical way to remove lead hazards from houses. And we worked on that quite a while and came to the conclusion, no, you can't. So there's really just one system that works, and that's the HUD system. So we spent considerable time learning that. And again, with white papers, we can save people considerable time, not having to go through that again. I must say, much against the reputation of large governmental organizations, HUD was extremely helpful to us, giving us quick, accurate answers to our many questions. And of course, you need a government entity to step up and say, yes, I will be the one principal applicant. And in this case, it was Sullivan County with Derrick as the county manager. The single best piece of advice we got along the way was to hire a grant writer, and not just a general purpose grant writer, but a grant writer that was experienced in HUD-led grants. And then enter Kate Kirkwood, who wrote our grant and is graciously continuing to help us in these early days here of trying to deal with it. It's kind of like, you know, the dog chasing the car. What do you do when you catch it? So today, our primary goal is to execute this grant properly so that 3 years from now, we'll be in position with a good track record to apply again. This is going to take many years, more than just one grant, to make a dent in the number of houses. So our other goal is to develop local expertise and provide local jobs, both in construction and management of this program. So we are thrilled, very happy with this program. However, in the mega view, the arithmetic is working against us when we rely on HUD to fund all the abatements. There's just too many houses. Federal money is powerful, but nowhere near as powerful as free market forces. So when we're doing all these other things, legislation, inspection, medical screening, funding, education, enforcement, product liability, professional licensing, and all these other things that got to happen, I'm asking people to start thinking about how can we bring market forces to bear. Today, you rid your house of lead paint and you get no market increase, no price increase in your house. Why not? You put on a new patio or a screen porch, you get a market bump. We ought to try to find a way to get one for removing lead hazards. The current set of rules and regulations brings a quote-unquote perverse incentive where it's more sensible for people to avoid the topic. Indeed, people are advised not to test or investigate their lead hazard situation, because then if they do understand it, then they will have to disclose, as opposed to just being able to say, don't know on the mandatory disclosures. So who should be advising the buyers to look into the lead hazard situation before they offer on a house? Real estate professionals, closing attorneys, lenders mostly don't press the subject. Maybe it has to be public health officials who make the issue of lead hazards in the home buying and selling process important. So I'm going to stop right there. I think it would be nice if someday the brokers will start to say to their customers, you know, you can get a little more money for your house if you take care of this lead hazard situation beforehand. Or maybe we can get to closing earlier. Or maybe attorneys will advise their clients to be careful about buying a pig in a poke with a house that they don't know the lead situation about. So as we're doing the good fight, if you can start thinking about ways to get economic self-interest involved. So over to Vic St. Pierre, who talks about another sort of primary protection, dealing with water supplies.
Vic?
Hi there. I'm Vic St. Pierre's former DPW, and I'm going to talk about lead in the water system. And it all really started in 2016 when Flint was the big issue. And we know we had lead components in our system. We had very good records all the way back to 1900s. And some into the 1800s. And we found that Claremont used lead line pipe between 1912 and 1934. And you can't tell the difference between lead lined and cement lined pipe at all. So yeah, we actually had to cut into it to see the difference, but our records told us where those were. So at that point, we had about 250 service lines with lead line. pipe, and we're down to about 40 now that we still have to change. On the city side, homeowner side is a little bit different. They have to remove that on their own, although we have been working with most. As we are digging, it's very easy to pull in a new line. The lead goosenecks were used in the water system to adapt from the mains to the services from 1900s to all the way to 1950, 1960 in some places. Lead goosenecks are bendable, and so they made the adaptation very easily to two very stiff pipes. So that made the transition. And we're trying to get all of those out. We still don't know how many are in the system. And some records were missed in the 70s and 80s, so some of those have been changed. But the only way we can find out is by digging it up. So what we have done is we had records with DES that went back, that they've done lead testing by EPA standards. And we found that we had a situation between 1998 and 2005 that was very similar to Flint, Michigan. Our corrosion control was not correct. Our water was showing iron or red. And we did some major adjustments at the facility, at the water treatment plant, and we have adjusted that so that our last tests last year, we did 20 tests of lead lines that go into houses, and we had a non-detect in all 20 houses. We will be doing it yearly. We don't need to. We will be doing it again in October, which starts, tomorrow. We will do 20 new houses and check again to make sure we are still non-detect. We do not want any lead getting through our system. And so far it's gone very well. Cynthia Clevens, I believe, helped us develop our testing program. She moved the houses that we were testing into more age-old housing so that we could get adequate tests. It's going very well. In the meantime, we are trying to get all the lead lines out. We have found more lead components in some of the 2-inch mains with the connectors in those. So we are undertaking a major renovation of the water system for 2-inch and smaller pipes. Ended up about 80 streets in Claremont. So it'll be a major project, but we have gotten funding from DES. They have worked wonderful with us. I can't say enough about DES. They really have walked us through step by step and made sure that we're doing all the right things. And I really appreciate those. So if there's anything that I can suggest is, if you think you've got lead components in your water system, contact DES. They are amazing with helping you set up a system to fix it. And we're down to zero detect, and we'll find out again this month whether we still are. And I do want to thank Mayor Lovett for taking control and making this happen. It was overlooked for 10 years to 16 years, and those are the special ed kids that are in our high school now. And I think it's the biggest tax saving, property tax saving thing we can do as a city, but also that it needed to be addressed and not just shoved under the table. And so we're wide open about it and really love to talk about it.
Thank you, Vic. Steve, did you have any comments you wanted to add?
Yeah, I'd just like to add that I'm building official and health officer for the city of Claremont, and I think those two roles are vital as far as spreading education. We're basically frontline with the workers that work on potential lead hazards, so we're a direct conduit to them, and it's important that we spread the education to them. Some people know about it, some don't. The ones that don't, there's ways of working with them to make sure that they're doing things the proper way and by law.
Thank you, Steve. Jessica, I know we're running out of time. Do we have questions or time for questions at this point?
Yeah, I want to thank you all so much for sharing Claremont's approach and everything that you've done. We are at time, so we don't have time to take the questions there. There's one question from Beverly in the chat if you'd like to answer it. It's just, do you think all cities or towns have a master plan like we do?
I'm not sure if they do, but I know you have to have a master. I think it's by law, though. You're supposed to have a master plan and have it reviewed every 5 or 10 years. It's critical, though, for communities going after grants. To have a document that states what your priorities are and why you're going after certain state or federal monies.
Okay. Yeah, thank you. Thank you again to all of you for sharing this information. I think we're going to have to conclude this talk and direct the participants over to the sessions. On the left-hand side, blue tab, named sessions, and you can join the session that you are interested in for the next segment. But thank you all once again. We really appreciate you coming and talking to us today.
Thank you.